Well, hello, everybody. Good afternoon or good morning, depending on where you are in the country. My name is Garrett Schmidt. I'm the CEO and managing editor for VBC Exhibit Hall. And I'd like to welcome you all to today's live webinar hosted by WellSky. And it is called Post-Acute Care, the Nexus of VBC Success. I think you are going to really enjoy the discussion today. I got a little preview of it yesterday, and there's a lot of great material that we're going to be covering. It's going to be a little shorter than normal. We're going to pack in a lot of material. So if you have a question, we are going to have a short time for Q&A at the end. Go ahead and ask that at any point using your control module. There's a place for questions, and you can ask those there. And we're going to get to as many as we can. If we can't get to yours or aren't able to in the time we have allotted, someone will reach out via email afterwards to make sure we answer your questions. So even if we're wrapping up at the last minute, go ahead and ask your question. The session today is being recorded, so what's going to happen is when we're done here, maybe about an hour or so after we conclude, you will receive an email, and there at the email there will be a link to where you can go and actually review and watch the recording and download the slides, because there is going to be a lot of material covered today that you may want to review. So if you want to review it later, share it with friends or colleagues. We hope that you do. And finally, without further ado, I wanted to introduce our speakers today. With us, we have Ms. Rhonda Sanders, and she is the Chief Mission Access Officer with Empath Health. And we have Mr. Tom Martin, and he is the Senior Director of Data Insights with WellSky. So welcome, you two.
Great. Thanks so much, Garrett. And thanks for everyone in attendance today for joining us. I'm confident, short but sweet, but this will be hopefully a session well worth your time. And really, the big reason for that is because Rhonda from Empath Health has graciously agreed to join us today. So let me just start out with extending a huge thank you to Rhonda, not just for being here today, but also contributing so much to the content that everyone's about to see. Primarily today, we'll be hearing from Rhonda as she outlines some of the strategies and successes Empath has put in place implementing CarePort Connect, and how that work, hasn't only benefited the patients they serve, but also played a critical role in supporting the ACOs that they partner with. Empath is, really stands out as an organization that is proactively, looked for ways to improve their workflows and deliver better outcomes with technology. And it's been great to see you guys using Connect over the last few years and have some success. So I'll let Rhonda, take the lead as she mostly walks us through some of those challenges and how they solve them. But first, I want to jump to a poll question. So Leah, can we kick that off? Okay, great. And I was wondering, just to get a better feel for who's in attendance today, let me ask the audience if you could just briefly tell us what organization or what type of organization you are with today.
Okay, so you should see on your screen here a little poll that you can play along at home with. So, and this is anonymous, by the way, so you can feel free to answer this. And we just thought that it would be a fun way to see who else is in our audience today and see your colleagues with us. And so we've still got the results coming in. So we'll give it a few more seconds for everyone to answer. And again, what type of organization do you work for? Is it a hospital health system? Is it a home health and or a hospice? Is it a SNF or a skilled nursing facility? An ACO or a payer? And I know these days the lines can blur. You could be all these things.
Yeah, right.
But what would best describe you? All right, I think most of the responses have come in, so I'm going to go ahead and shut it down in 5, 4, 3, 2, and 1. We've got a couple things rolling in here, so I'm going to go ahead and show the results. Here we go. All right. Sorry if you didn't get a chance. We're going to have another one here for you to in a little bit. So it looks like if Rhonda and Tom, are you able to see the results here?
Hospital and health system for the win, but it looks like we got someone represented from all types, so that's great. Perfect.
Yeah, very cool.
Thanks for completing the poll. And back to slides. I guess Rhonda, you're going to kick it off. Why don't you tell us a little bit about Empath and the services you offer?
Sure. Thanks, Tom, and good afternoon, everyone. So to tell you a little bit about Empath Health, We are a post-acute healthcare organization, not for profit in Florida. We do serve 20 counties in the state of Florida. We've been providing services for 48 years in the post-acute space. So some time, right? And we ventured into value-based care over the course of the last 10 years. So we started with PACE, all-inclusive care for the elderly, which is a capitation model that is full risk. We also started our own ACO 2 years ago, Responsive Care Solutions ACO. It's an MSSP ACO, and we did save CMS $6 million last year, so saw some success there as well. And then we ventured in this year to the ISNP space, so Institutional Special Needs Plan, which is a Medicare Advantage plan for nursing home residents. So we like to offer a continuum of care for our patients through what we like to call full life care. So we provide home health services, skilled and non-skilled hospice care, and a wide variety of community services. So really what we've seen as being a group that is involved in value-based care is fragmentation across the board. So we really would like to focus today on some of the challenges that we face in healthcare and help others navigate this space. As we know, healthcare can be very fragmented and we face many challenges every single day. So we'll walk through a few and how we've been able to partner with WellSky and CarePort as well as other solutions to be able to provide excellent, high quality of care to our members. So our first challenge that we really faced was manual processes. What we faced here at Empath Health is while we have a robust EHR system, we kept hearing from our partners that there was a lack of information. So they needed more information and we needed to be able to share. A great example of this was actually brought to us by one of our oncology partners in the state of Florida. So it is our largest partner in the state of Florida, and they operate throughout the state of Florida through their oncology practices. They needed specific data related back to death. And while we were providing death notifications back to them, they needed the reason for death and the actual death certificate. They needed to be able to report this back because they do also participate in shared savings. So we really needed an actionable way to do this in a centralized repository. So through our partnership with CarePort, we were able to customize our approach. But before that, we were manually pulling the data and making phone calls. We want to make sure that our clinicians are always practicing at their highest scope, and this was not it. So manually pulling data, sending this out in a spreadsheet or an email format was not allowing them to practice at their highest scope. So we actually developed a centralized repository to help manage patients across the continuum to make this process easier. And also to reduce the risk, because as we know, human error happens, and we wanted to make sure that it was the most accurate data possible. So this helped us improve, manual processes and really customize and standardize those processes. And then I think the second piece is really the lack of patient visibility. Time and time again from our partners, whether it be geriatric at-risk partners, accountable care organizations, or our hospital partners, they want to know more information about changes in condition of their patients. It's critical in terms of care coordination. And so this really became a barrier for us. I can give an example. We had a large partner who may be on this call today in Southwest Florida who came to us and shared that they were really struggling with the fact that they needed to know when patients presented at the ED. They really wanted to hear more information about their hospitalized patients or just when their patient had a change in condition. So we were relying on, of course, our clinicians to reach out, and what this presented was an opportunity for us to streamline the data. So we've been working, this particular partner also had a connection to CarePort. So we were able to really customize our approach, and we're still working on this and in the process, but create a bi-directional workflow so that they get the information that they need on patients to make real decisions. And we want to be collaborative as well. And oftentimes in the hospice space, people feel that, our medical directors, the hospice medical director, takes over the care. But that's not our goal. Our goal is to involve our value-based partners as much as possible, as well as the primary care and the overall care for the patient. And when we do that and we can customize our approach and really collaborate in the best interest of the patient, we see better outcomes. So this was really a great example through increased patient visibility through CarePort of being able to provide that. And then I think the third area that we had significant opportunity is that we've been disconnected from hospitals and other partners. We see this with multiple EHR systems, and that disconnect occurs. And so what we really wanted to see was how can we connect and provide real-time patient information back to our hospital partners and our healthcare partners in a meaningful way. We have excellent outcomes here at Empath Health. We lead the industry in our area, but we wanted to be able to deliver patient-specific information and real-time outcomes back. This really set us up for success in working with a partner in Southwest Florida. We had worked with them for a number of years, accepting the hospitalized patients, but we didn't have a real way to get this information back to them on how this patient was doing on our service. They launched a care collaborative. And so this is how we really came to find CarePort, is through this care collaborative. We were asked and selected to be a part of the care collaborative. And so we signed up for CarePort. And it's been a fantastic experience because it's allowed us to enhance our partnership with the hospital and therefore increase our volume as well. So it's been a real win for us in terms of connecting. And I think for us, as we, move forward, I think connection is key. And it's allowed us to grow our hospice footprint, as we all know, and I'll pass it over to Thomas. There's been an underutilization of hospice care. So through enhanced data, we've been able to increase our utilization of hospice.
Yeah, thanks, Rhonda. And I'll jump in and echo a challenge that in CarePort Connect, we made a concerted effort to address about 2 years ago. And it's something we heard a lot about from our clients, and that is that underutilization of hospice and the palliative care benefit. Obviously, hospice, palliative care are essential for delivering high quality end of life care. And yet we know and read in many places that it's often a benefit that patients and families sort of miss out on. One of the stats, and I imagine many of us have read this one before, but over 25% of the Medicare spend for a beneficiary occurs in their last year of life. And that's, driven by intensive medical interventions. And while these interventions are well intended, they often don't always align with patient and families who are truly seeking just sort of like comfort, dignity, and quality of life in those final days. And despite access, being eligible for that benefit, even when a patient gets on that benefit, the median hospice stay is less than 18 days. And over 50% of Medicare beneficiaries access that benefit for less than a week, right? And this suggests that those benefits are not fully being utilized. One of the reasons for this underutilization is certainly like the prognostic uncertainty of when is the right time for that patient to talk to that patient about that benefit. And so I think one of the things I want to talk about in a later slide is some of the predictive models we have put in Connect. One of them identifies patients that are end of life and might be appropriate to start that hospice consult with someone, certainly you wouldn't do this in an automated fashion, but when to triage that patient, this is a person that should talk to someone about getting on the benefit. Just jump, Leo, next slide. Oh.
Yeah, and in terms of Empath Health outcomes, we started out with a very fragmented process that was obviously plagued by error and delays and updates. And so that was really not a good solution for us. And it, was fragmented. And so I think what CarePort has allowed for us is to really enhance that care coordination and improve it. We have great data coming out of our EHR, and we need to be able to share that real time. So we've customized our approach, and now we can share, really valuable information to help improve care coordination and our collaboration with our partners. And if we move to that next slide, we can talk a little bit about, what that's enabled us to do. And how we've improved value-based care success. So we've been able to improve care and cost savings across the continuum. We all know that providing timely information is really critical to support partnerships and to support patient outcomes. And collaborating with care teams is real time. So one of the ways that we've been able to really improve is providing information back to our partners real time, and we collaborate around the decision. So I'll give an example here. If we were to have a patient present in the ED, we do have teams that are dedicated to the hospitals. And if we get this information back from CarePort that one of our patients has presented at the ED, then we can immediately share this information through CarePort with our partner and collaborate on the most appropriate setting for this patient. So we would have our clinicians go to the ED, meet with the patient and family, really better understand the situation. And, oftentimes we can bypass the hospital system and really delay those unnecessary hospitalizations, because we have care centers here at Empath Health. And so if it was a hospitalized hospice patient that was in need of a higher level of care, we could immediately transition them to one of our care centers where they would get the most appropriate care. Or we could provide continuous care in the home. That's going to be a lower cost for the overall care of the patient, but most important, the patient's going to get to reside in a more comfortable space. And so I think that it's a real opportunity to avoid those unnecessary rehospitalizations. It also helps the hospital because it frees up their bed space for someone who really needs it as well, that can't be taken care of in that setting. So some ways that we measure, if you will, the enhanced patient experience that we've been able to achieve through this mechanism. We've been able to improve patient engagement. So we've been able to enhance health literacy and understanding. We've also been able to improve patient engagement in the care plan by providing more of a collaboration approach with our partners. And then we also track quality of care improvement. So we have lower infection rates by enhancing our collaboration and improving our care transitions process. We've also improved adherence to the treatment and care plans. When we can make real-time joint decisions with our partners, we've been able to accomplish this. There's also been a significant cost reduction where at Empath Health, we're looking at this as well because we participate in the value-based space, but we also are partnered with others that are participating. So whether that be a geriatric primary care that's at risk, or an ACO. So that decrease in total cost of care is really important for us. We also have been able to see decreased utilization of hospice and ED. Right now, our Empath Hospice actually have a less than 1% rehospitalization rate, which is just fantastic. But I think it's this enhanced care coordination that we've been able to create through the technology and the partnership around data sharing. We've also been able to improve care coordination, really reducing some of those medication errors by that bidirectional flow of information and collaboration and partnership. And then we've also been able to just see an improved patient outcome and share that with our hospital partners, because that is really crucial. They want to partner with someone that's delivering those highest quality results. And also collaboration comes into play with these relationships. And then we've also been able to improve our patient satisfaction. We've improved our HCAHPS. We've also improved our Net Promoter Score through this enhanced collaboration across the continuum. And then in terms of our patient outcome improvement, our readmission rates, as I've stated, have improved on the hospice side, but they've also improved on the home health side. And we've seen within our value-based care entity, our PACE entity, that we've been able to improve our readmission rates for our PACE patients as well. And then in terms of increased length of stay on hospice, Tom hit the nail on the head with his slide around hospice. There is an underutilization. And by helping prognosticate and really identify hospice patients sooner, we can increase their length of stay on hospice and improve their overall quality of life. So that's been a benefit as well in working with CarePort. And then we've seen, on the home health side, especially through this shared data, an improvement in overall functional status for our patients. So those have been some wins around care and cost savings across the continuum that we've been able to see by working within the CarePort and WellSky platform. And, I think that this has been really a building block for us too in regards to our relationships with hospital systems. It's really helped bridge the gap between ACOs and hospitals. Every, ACO that I meet with or geriatric primary care group, they want data, they want the collaboration, and that's how we partner together to achieve cost savings and quality. So through this enhanced partnership, we can provide real-time information. We also provide visibility into the patient's history and utilization and intervene earlier to optimize cost savings and enhance quality. So some of the ways that we've really worked with geriatric at-risk groups and ACO partners is patient-centered goals. Patient-centered care is so important today, and we really can share those patient-centered goals and what's going on in the home and what the patient's priorities are, because then they become more involved in the care plan. And if they see that collaboration going on with their primary care physician and their post-acute, then they became more engaged in their overall care. And then we also, see earlier intervention requests. So by sharing this data real time, you can really outline, the need. We say this all the time, but right care, right time, right place modeling is essential to winning in the value-based space. So, but through this data sharing, you can really intervene earlier in the process and see enhanced outcomes. And then in terms of the multidisciplinary care, hospice is a great example, as is PACE, on a multidisciplinary care approach. We're treating the patient holistically, and that means their social needs as well as their medical needs. And so we take a multidisciplinary approach, and we can share this with our care partners so that they're more informed as well as to what's going on with the patient and the patient's family. It also allows us to really provide continued monitoring and change in status updates that are critical. You've heard me say in the example of the oncology practice that we work with, these real-time updates are essential for those participating in value-based care. And so we're able to monitor and really provide those status updates. We also have seen a great impact on polypharmacy and medication reconciliation, which are two primary reasons for rehospitalization, through enhanced data sharing. And then also changes in care setting and condition. It's just crucial to know when patients are ending up in the ER or at the hospital. So again, this is great information that we've been able to really bridge the gap with our ACO and hospital partners by providing real-time information and coordinating care. And then I think the last thing, it's really about coordination and collaboration. We've built relationships with our partners. And I think that some of the ways that we've been able to really avoid readmissions are we did implement an ER divergence program, a call us first program, multidisciplinary disease management programs, which we engage our partners in and share this feedback and information with them on what's going on with their patient. We're also providing real-time patient education and then documenting this and sending it back to our partners. And what we've seen is just improvement in overall transitional care through coordination and collaboration through CarePort. We do, as I mentioned, have licensed clinicians at the hospital that are helping support that transitional care and care planning. So CarePort's allowed us to really provide that real-time update to those transitional care nurses as well. That leads to a deeper relationship and partnership. So I think that, in summary, I would love to pass the call over to Thomas where he can share exactly how CarePort works. It's been a fantastic solution for us that's really allowed us to improve our relationships and collaboration with our partners.
Awesome. Thanks, Rhonda. That's all great information. And maybe I'll just add, I know you talked a lot about how you use Connect to achieve these things. I'll just give a quick overview of the tool. So, Connect is a solution. It's designed for providers and really any stakeholders across the care continuum that have a vested interest in a population. At its core, and you can see an image of it right there, it's really a patient timeline that is tracking members as they move through the different care settings. So it's connected to acutes and post-acute, SNF, home health, IRF, LTAC, hospice, any provider a patient will show up in, we can track it in CarePort Connect. Today, we already have a sizable portion of acutes and post-acute providers contributing to the network. And where we don't, we have seamless integration with all of the large EHRs so that it's sort of a flip of a switch for a provider to turn on their data and start being transparent and share that data in Connect. And we are integrated with a lot of the state health information exchanges too, to help us further fill out that gap. So we really have a pretty good purview of where a patient is across the US. And, as an example, if we were to receive a roster from an ACO of all of the members that they manage, you could track that patient across all of the shared data sets we have in Connect. Now, Ron, I think you already did a good job pointing out just knowing where and when that patient is at a certain location is very beneficial. In addition to that, Connect also has a lot of rich information on that patient's clinical profile. So we have things like continuity of care documents and MDS assessments, the clinical record of the patient when they're at that site of care. We also offer through the Connect timeline an ability to chat, right? Identify that patient and chat with shared stakeholders, with the physician, the post-acute provider, or the acute provider, so you can all be on the same page in the same place when that patient suddenly has a new event in the timeline. And then finally, where my team comes in, since I run the analytics department that supports CarePort Connect, we have various predictive models that help triage patients for various outcomes. So I know there's a lot of adverse outcome models out there. And I'd like to say our models are the best because we have the best data scientists at CarePort, but that's probably not true. We are all deploying similar models. But what is unique about what we can do with our data set at Connect is, for example, when we're looking to identify a patient in a skilled nursing facility that might benefit from a hospice consult, we have access to the profile of that patient when they admit to the SNF, right? So we know what they look like there. We also know why that patient was in the hospital, right? What was the acute event that led to them needing post-acute care? We are collecting data, all sorts of data. We actually purchase, we are a CMS innovator. So we have all historical claims data and pull data from Medicare.gov. And we understand the characteristics of the providers where a patient is at, right? The provider level characteristics. We know where the patient is located, where their home is. So we know information about their community, like the area deprivation index. And then we just sort of have this longitudinal view of what was going on with that patient in the last 12 months. And, as you can imagine, knowing if a patient's been in the hospital 4 times in the last 6 months is very predictive of adverse outcomes. And so, Lee, if you just slide one more, just, as an example, here's a fake patient in the Connect timeline that you could search for that we believe is a good candidate for speaking to someone about hospice. And the way we flagged, actually, it's sort of an uncommon flag in Connect. About 1% of SNF patients will ever see this flag. But when we do flag those patients, we have found since about 2 years that we've launched this, 50% of those people with the flag will expire in the next 6 months. So it's like a pretty strong indicator that this patient is likely to benefit from that conversation. And so this is just, one of the features we have in Connect with our predictive modelings to help alleviate that prognostication problem and identify people earlier who would benefit from hospice care. Okay, and then let's do one more poll for the group here. And I'm just curious, after hearing a little bit about how this technology can be deployed, where is your organization today at adopting technology to track patients and collaborate care?
All right, so you will see this on your screen. And for those of you who have just joined us recently, these are anonymous, but we're going to show you the results to kind of see where you stack among your colleagues here in just a moment. So the question here again is, where is your organization in adopting technology to track patients and collaborate across the continuum? And first choice is, we're not really considering it yet. Interested, but not ready at the moment. Exploring the idea, actively researching and gathering information, or we are already using a solution. So we're going to give it just a few more seconds for the results to come in. And then we will show you the results. So it looks like most people have voted at this point. So we'll give it about 10 more seconds. Okay, so I'm going to go ahead and shut it down in 5, 4, 3, 2, and 1, and share the results. Okay, Tom and Rhonda, are you able to see these results?
Yeah, it looks like actually we already have a lot of people using the solution, which is fantastic. And then we have sort of a spectrum of responses for people looking to deploy this type of technology. That's great. It's super helpful feedback for us. Thanks for responding to that poll.
Yeah, it's truly great to see. It's truly great to see that so many people are engaged and involved in data sharing and already. And I think some of the key takeaways from today, identifying patients early who need hospice or palliative care is really crucial. And, what I will say is that there's been studies linked to a cost savings when you're able to do that. And through the CarePort technology, we're able to identify those patients earlier who need hospice or palliative care. And we can really make an impact on their overall quality of care when we intervene earlier. And then reducing readmissions with ED is really, really important. So obviously, bypassing the ED whenever possible is crucial. We can reduce readmissions and reduce the overall cost. And when we intervene early through collaboration and partnership, it really enhances the quality for the patient. And then last but certainly not least, improving communication between ACOs, hospitals, and post-acute care providers is so critical in the world that we live in today. Our patients are complex. They have more complex medical needs than they ever have before. So when we can enhance our communication and data sharing between post-acute care providers, ACOs, and hospitals, it's a win for the patient. And so we want to open it up for questions that you all may have today, but it's been a pleasure talking with you about our journey.
Wonderful. All right, so we do have a few minutes for some audience questions. If you do have a question for either Rhonda or Tom, go ahead and drop it now into your control module there. There's a place for questions specifically, and we're going to get to as many as we can. First question is this, what data do I need to send to CarePort to have access to predictive models in CarePort Connect?
Yeah, that's a good, I can take that question. Typically, as an acute, when, you onboard with Connect, you start using the tool, there is an integration process, but for the most part, what we're looking for is very standard, right? As you can imagine, the data points we are looking for are standard across hospitals and post-acute providers. It's not like something that requires a lot of consideration on behalf of the client looking to implement. Like, these things are standard. Our models are based off, ADT feeds, diagnosis codes, clinical information, age, gender, history of utilization. So all like very standard things that are common across all EHR data sets.
Great. Next question is this. I guess this is probably more for Rhonda. What was it for you that was the impetus to make your investment into technology, and what are those data points from your partners?
Sure, I think it was the need. So as we went out there and we met with our partners in the community, the need was real. They needed that real-time information, and while we were providing that, through our nurses, through collaboration, it was all a manual process. And so what we found is that there were some gaps, there were some challenges. We heard feedback that our partners were not getting all of the information that they needed. So when we were able to standardize this through data sets and a more formalized approach, we really cut down on some of those service challenges and service failures.
Wonderful. Okay, next question here is this data contingent on using CarePort for referrals?
I can take that one. No, it is not. We have various clients that are using Connect and Insight that are not using one of our referral tools. So it's possible to integrate with Connect without using one of our referral solutions.
Wonderful. And we did have one that actually came in as a comment. And this is, I promise this is not a seed question here, but it says, great presentation. We have CarePort, and this has given us a lot of additional insight on how to enhance our use. So thank you again. This is a fantastic presentation. So,
Great.
All right, next question here is, how do you get members and families to engage in the hospice discussions?
I think in terms of members of families to engage, we really seek that out. So we encourage them to become a part of the process. So we invite them to the discussion as a group. The patient's wishes are most important, but we engage as many, family members as that patient wants involved in the overall care. We recognize that oftentimes, depending on where that patient is in their process, their disease process, family becomes very important in the decision making. And so we try to make sure all the decision makers are at the table and really engage them and answer their questions. Oftentimes, family members have more questions about the hospice benefit than the actual patient does. So if we can engage patients' families and make sure that we're answering all of the questions that they have, it's going to be a benefit. So.
Yeah, that's definitely, that's a tough one and very important. Okay, next question here, and this may or may not be something you can answer easily here, is Is Connect an additional cost, or is it readily available to all users of CarePort?
So Connect, you can sign up for Connect. It is a solution we offer with the price, but there are certain features available for collaborators as well. So details of that we'll probably have to take offline, but they're both options are available.
No problem. No problem. Well, it looks like that is all the questions that have come in. So we're going to probably go ahead and wrap up early. But Rhonda, Tom, thank you for a wonderful presentation. There's obviously a lot here. If you have a question for Rhonda or Tom, you can still drop it into the Q&A or the question module, and we'll get those later, and someone will reach out to you via email. But as we close out, I wanted to encourage you all to head over to vbcexhibithall.com, and you can check out the WellSky virtual exhibit booth there and read up on what they're doing and the CarePort tools. And there's a lot of great information and resources. And of course, you can reach out to them through there and there's and kind of educate yourself on what they're doing. There's also a lot of great resources in the vbcexhibithall.com library, which is also where this recording is going to be archived. And so if we are going to send it to you, so you will get an email with a link to the recording and the slides. But if you wanted to see this and other great free webinars, you can see that there. And then finally, if you would like to reach out to the WellSky team, feel free to do that. You can see their email address here, and this will be part of the slides that you can download, or feel free to reach out to me. I'm happy to connect you if that's easier and facilitate an introduction that way. But thank you all so much for joining us this afternoon. Thank you, Rhonda and Tom, again, for a fantastic presentation, and hope you all have a very happy holidays and a great rest of the year. So thanks so much for joining us. Bye-bye now.
Thanks, everyone.